Hey guys, are you dealing with pain in your foot, ankle, or heel that just isn't getting better? Maybe you sprained your ankle and it should be healed by now, but it's still giving you problems. Or you have heel pain, you've been told you have plantar fasciitis, and it's just not improving. Or you have pain in your foot, either on the top or the side or the bottom, and you're not sure what to do about it. In this video, we will cover how chiropractic can help with ankle, foot, and heel problems, and why it might be the missing link in helping you to get better. We'll also cover how shin splints could actually be coming from an ankle problem. Now, in my video on extremities, I covered one of the primary subluxations in the ankle, which occurs at the tibial-talus joint, which is the main hinge joint between the leg and the foot. If you're not familiar with the term subluxation, I encourage you to check out that extremities video as I explain it there. But for our purposes here, a subluxated joint is out of alignment and stuck. And the correction of that subluxation is through an adjustment, which restores proper motion and alignment. What I want to dive into a little deeper here are what some of the consequences of that subluxation are, and which can be indications to you that you might have this problem. The first most obvious one, as I mentioned in that video, is the result of a sprained ankle. You may have pain and swelling right over that joint and often to the outside of that joint on the lateral part of the ankle. Obviously, ice and rest are key in getting the swelling down. And the best way to ice an ankle is take a 5-gallon pail, fill it with water so it goes up to about middle of the lower leg, and put enough ice in to cover the surface of that water and ice for about 15 minutes. How much you ice it will depend on how much swelling there is. But in addition to ice and rest, if the ankle is subluxated, that subluxation needs to be corrected in order for it to heal properly. And it will heal a lot faster as well. If it is the tibial-talus joint that is subluxated, the correction will look like this, restoring proper motion and alignment to the joint. The tibial-talus subluxation can occur in other ways in addition to acute trauma to the joint, such as small microtraumas over time that you may not be aware of. What may be some indicators that this might be going on? Well, when this joint is subluxated, it can affect the lower leg above the joint or the foot below the joint. When it affects the leg above the joint, it can show up in the form of shin splints. So shin splints, medically known as medial tibial stress syndrome, is a common overuse injury in runners and athletes. It causes pain along the front or inside of the shin bone or tibia, and occurs when muscles, tendons, and the bone become inflamed from repeated stress. Common causes are sudden increase in activity, so too much too soon, improper footwear, running on hard surfaces, and improper foot mechanics, which is where the tibial-talus subluxation comes into play. Think about it. If this joint that connects the leg to the foot isn't moving properly, the muscles in the lower leg have to work that much harder every time you raise up your foot to take a step. In addition, every time that foot strikes the ground, instead of the shock being absorbed properly through the joint, that shock goes right up into the lower leg. So if that subluxation is occurring and then is corrected, it can make a huge difference in helping recover from shin splints. So that can be the upstream effect of that subluxation. How about the downstream effect in the foot? Well, in the same way that it affects the muscles by having to overwork in the case of shin splints, those same muscles insert into the top of the foot, which can cause pain there as well when that ankle joint is subluxated. So many times I've had patients complain of pain on the top of the foot, and when we correct the tibial-talus subluxation, that pain subsides. The same subluxation can cause pain at the bottom of the foot as well. Also, similar to shin splints, when the foot strikes the ground and pushes off, instead of that shock and pressure being absorbed in the joints of the foot, more pressure occurs at the bottom of the foot towards the toes. Again, correction of the tibial-talus subluxation can help with that. All right, moving on from the tibial-talus joint, but staying with the bottom of the foot, another subluxation that can cause pain there is an inferior metatarsal head. Okay, what? Okay, so the metatarsals are the long bones in your feet, of which you have 5 of them, and the head of the metatarsal is where it connects with the toe. An inferior metatarsal head is when the head of the metatarsal drops inferior in relation to the toe. Patients will often complain of pain when walking, especially when pushing off with their foot. If chronic, this can lead to calluses on the bottom of the feet and also hammer toes, where the toes curl up. Correction of this subluxation involves lifting the metatarsal head in relation to the toe. Moving on to the other end of the foot, we find a major source of problem for many people, the heel. Heel pain is quite common, and many people are diagnosed with plantar fasciitis. Plantar fasciitis is inflammation or degeneration of the thick band of tissue running across the bottom of your foot. It causes stabbing heel pain, typically worse during your first steps out of bed or after long periods of resting or standing. As you can see on the diagram, the pain point on that fascia is right in front of the heel, where this ligament attaches to the calcaneus. Now, we've seen a common theme with problems in the foot. When a joint is stuck, so the bone is not moving properly, it puts undue stress on the tendons or ligaments that attach to that bone. This is no different when it comes to the heel bone or the calcaneus. When the heel bone has lost its normal motion, it strains the ligaments or fascia attached to it, which in this case can cause plantar fasciitis. Correction of this subluxation restores normal motion to this bone, which takes the strain off of the attached ligaments or fascia. In addition to restoring normal motion to the heel bone, loosening up the surrounding tissue can help in the healing process as well. By rolling the arch of the foot over a ball, this can help break up the adhesions in this tissue, which can help loosen it up and take some of the pressure off the attachment point on the heel. Another factor with heel pain is tightness in the calf. This tightness can pull up on the heel bone, thus increasing the pressure on the fascia on the underside of the foot. Two options to help work out the calf tightness. One option is using a foam roller to work out the knots in the calf. The other option is to lay on the couch, hang your leg over the arm of the couch, stick a ball under your leg, and put your other leg on top of the one you're working on. This can actually target specific knots in the calf better than the foam roller. And finally, the other issue that can arise from calcaneus or heel subluxation is pain on the side of the foot. If the heel is stuck medially or towards the inside of part of your foot, when you're walking, it doesn't allow the foot to fully rotate as it strikes the ground, thus putting more pressure on the outside of the foot. Over time, this can get sore, and by restoring normal motion to the heel through an adjustment, this can alleviate this problem as well. Okay, so I touched on just a few of the issues that can arise when there are subluxations in the ankles and the feet. There are many more bones and joints in the ankles and the feet that can be subluxated that can lead to other problems, but in this video, I just wanted to highlight a few of the common ones. I also know that there are many other issues that can arise in the ankle, foot, and heel, and multiple factors that are involved with those issues. And there's other treatments as well that are beneficial in treating these problems. What I wanted to highlight in this video is the role subluxations play in ankle, foot, and heel problems, and how the correction of these subluxations can make a huge difference in helping these problems to get better. I've had so many patients who have struggled with problems in their ankle, foot, or heel for years and just can't believe it when, quote unquote, a simple adjustment solves the problem. So if you or someone you know is dealing with a problem in the ankle, foot, or heel, I encourage you to like this video and share it with them so they can find out about how chiropractic could help them. I also encourage you to subscribe to this channel so you can find out more about the different ways that chiropractic can help you and the ones you love. Thank you so much for watching, and I'll see you next time.